Let me ask you to do a little bit of exercise to start the process. I don't think you can do anything in terms of developing a strategy or an approach for your benefit design unless you are working off of a common set of basic principles. If you don't have any principles, you'll go all over the place. So here's some examples of some principles that I set out. And I think there's at least 2 pages of them. Yeah, 2 pages there, 31 items. I want to take about 3 or 4 minutes, so we're not going to take a long time, but I want you to glance through there, and you notice on the right-hand side, important and not important. So 1's really important, 5 would be it's not so important. Go through that list and circle some of the things that you think your organization, whether you're a benefit manager, you're representing another company, but what you think your company, if you want to put your mindset there, or what you think employers might consider. So you can do it either way you want. It's not something you're going to hand in here, but take a look at this list of items and don't put everything down as a 1, everything as a 5. You know, put maybe 5 things as 1 and 5 things as 5 if you have those, and the others somewhere in between, because I want to ask some questions about it. And while you're looking through those, this is one of the most important exercises if you can do it internally to your company. Because when I sit down with companies and that management team, the decision makers, and I have them independently go through this, and then we compare answers, it is amazing how different the answers are. So until you get everybody on the same wavelength around principles, you're going to have mass confusion along the way. So this is a way to sort of start to straighten out that string, if you will, of getting things right and building it on a solid foundation. Classic, any kind of health reform has to meet 3 standards, right? Cost, quality, and access. And the typical comment is you can't have all 3. You pick out 2, and the other one's going to be the bubble that comes out that you don't get the, you know, you can do access and cost, but your quality is not going to be that great, or you can do quality and access, and your cost is not going to be that great. So it's a good chart, it's very simple, and what's happening with consumerism, we're taking and developing some different approaches, the consumer involvement on the cost and transparency we've talked about on the access. Instead of being a supply control, it's now demand control. There's 2 things I believe that are really critical to demand control. And without them, you're not going to get any kind of cost savings, you're not going to get change in utilization, you're not going to change in any of the aspects that we're trying to drive change with consumerism. The 2 things you need are, 1, you need financial involvement, and you need information. One without the other one doesn't work. So just being transparent or health literacy by itself, that's not enough. You really have to have a financial stake in the game. Critical to controlling demand. And we're in a great experiment, whether that really works. Vision statements. After your principles, if you're going through this process with internally with your staff, I suggest you figure out a vision statement so that you have a common set of principles and a vision statement. And I've laid out some vision statements here, and in the interest of time, I'm not going to go through them. A lot of times I have people sort of, with the same kind of exercise, go through these and try to figure out which one sort of makes sense for your organization. But here's just some examples of a vision statement for your consumerism strategy. And these are actual examples of some of my clients where we wound up. And they're all a little different. So one says, number 2 here, affect employee behavioral change towards healthier lifestyles and greater consumerism through the use of rewards and incentives. They hadn't used any rewards and incentives. There was no reason for people to do something different. So they want to really emphasize that. I'll read one more here. Let's take number 3, it's a little shorter. Make employees better consumers of healthcare services by providing them with the necessary health information or education, decision support tools, and useful information, including provider cost and quality data. So their emphasis was a little bit more in their selection and principles around transparency and cost information. So that's what their overall vision. And if you don't write it down, you won't have that touchstone to go back as you're trying to make some of these decisions that you'll see later on. So it's really important to do the principles and a vision statement. It's another little exercise a lot of times I have folks go through, but again, I apologize. In the interest of time, while we have 4 hours, there's a lot of material to cover, and we can back up to this if we want to. But after you do your principles and your vision statement, here's some strategies. How are you actually going to accomplish it? Who are you going to engage as outside partners, as strategic partners? What are your strategies to do these? And what are you trying to do? So Again, high priority, low priority in these different areas. Create transparency. For some of you, that would be high priority. Create personal involvement. Be bold and creative. Focus on the high-cost Pareto population for focus on saving lives and improving health. Is that if you're just trying to cut costs, don't do it, because you won't get the end result. But if you go after for saving lives and helping people to be healthier, you'll save the money. But if you're just trying to save money in your strategies, your employees are already going to be skeptical about any change. We already talked about you don't want to upset the apple cart too much in these first steps. They're skeptical that you're trying to cost shift to them anyway. So if that's the message that they get out of your actions, they're not going to do what needs to get done to help you achieve your goals. But if they get the message you're really trying to help them be healthier and to save lives, your whole approach becomes different.